In this video, we will discuss about hypersensitivity reactions. The same question is being asked in January 2025, paper 1 of MD General Medicine exams of RGHS University. So along with exam going internal medicine residents, even other medicos must know the concept of hypersensitivity. First of all, what is hypersensitivity is? It is an immune reaction causing tissue damage. So what happens here is, there might be either exaggerated response to a harmless antigen or a normal response which is deployed inappropriately. And mainly there are 4 classes of hypersensitivity reaction: type 1, 2, 3 and 4. So type 1 is usually we consider immediate, type 2 is cytotoxic, type 3 mainly immune complex mediated and type 4 is cell mediated. In type 1 mainly, the antigen will be coming from outside and it will be a free floating antigen, but antibodies are fixed. So they will be fixed, mainly IgE antibodies will be fixed over the mast cells. So whenever they are being triggered by the free floating antigen, there will be an immediate response, that is nothing but type 1 hypersensitivity reaction. But in type 2, what happens is, here antigen is fixed over some tissue of our own body. For example, in case of autoimmune hemolytic anemia. So over the RBCs, there will be the fixed antigen, and to that a free floating antibody will come and react. That will lead to type 2 hypersensitivity reaction. So here the antibody is free and usually it will be IgM or IgG type of antibody. Whereas in type 3 hypersensitivity reaction, both will be free, antigen as well as antibody. When they come together, they will form immune complex. That immune complex formation itself is the igniting factor for type 3 hypersensitivity reaction. Whereas in type 4, mainly T lymphocytes. And the point here is, there are no antibody involved in type 4 hypersensitivity reaction. So all these things we will discuss in detail. Coming to the type 1, happens in 2 phases. For example, you have visited your friend's home and they have a pet there, for example a cat, and during your first visit you have come in contact with that cat's fur and all. That is a kind of allergen to which you are being exposed. So in that case, the body will produce IgE antibodies, and these antibodies will come and sit over the mast cells and they will be fixed here. So these mast cells are present near blood vessels, near mucosal cells and near the epithelial cells. So now at all these places mast cells are there, and over that the prepared IgE antibodies are fixed and they are ready. So this is what sensitization phase. Next, suppose you visit such similar environment again, then what happens is, the similar exposure of the allergen will immediately activate these mast cells and there will be immediate response from the IgE antibodies. So this secondary exposure will result in an immediate reaction. That is nothing but type 1 hypersensitivity reaction. So the points here are, it will be usually immediate. IgE antibodies are involved and mast cells are involved in this. So these are some important points. Now, once the mast cells are activated, they will release few of the chemicals. For example, histamine and phospholipase A2. So this histamine is vasogenic. It will cause vasodilation and endothelial cell constriction. So this will lead to what? There will be flushing and leakage of fluid from the capillaries into the interstitial space. So these are the results of vasodilation by histamine. And this histamine is also spasmogenic, mainly smooth muscle contraction will happen, and majority of the times in the bronchial wall, smooth muscles will get spasmogenic response. Also, as mentioned, these are present near mucosal cells. They will lead to the glands stimulation, leading to increased secretion. So you might see many times when we are being exposed to pollen or dust, all these allergens will lead to type 1 hypersensitivity reaction, where we will be getting excessive sneezing, like increased secretions, flushing will be there, and there might be development of difficulty in breathing because of bronchospasm, and sometimes it might even lead to anaphylactic shock because of the distributive type of shock which happens in type 1 hypersensitivity reaction. Whereas the other compound which got released from mast cells is phospholipase A2. This will utilize phospholipids and by the stimulation of two enzymes, that is cyclooxygenase and lipooxygenase, there will be production of few of the chemicals such as prostaglandins and leukotriene B4, C4, D4, etc. So all these are strongly vasogenic and spasmogenic substances, just like histamine. In fact, these are even more stronger compared to histamine. So what are the examples? Mainly anaphylactic distributive shock, bronchospasm, allergic rhinitis or asthma, even in cases of skin rashes or some medication related allergies, we will see type 1 hypersensitivity reaction. Coming to type 2 hypersensitivity reaction, where we mentioned that the antigen is fixed, but antibody is free, which will come and act with this antigen. So again, this type 2 we can divide into three subtypes. Subtype A is related to cell depletion. Subtype B is inflammation related. Subtype C is receptor dysfunction. So here, to understand this, we need to imagine a day-to-day scenario which might happen in and around our surroundings. For example, mainly in cell depletion type 2 hypersensitivity reaction, what happens is, just imagine a kid is quietly sitting outside his home and some kidnappers will come and abduct the kid. So this is what happens in cell depletion type. For example, on RBCs, there will be presence of some antigen and those are fixed. And the antibodies will come and just opsonize this RBC and they will take it to the spleen where it will be lysed. So this is what happens in autoimmune hemolytic anemia. So resulting in cell depletion. But the thing is, they are just silently taking away the antigen and leading to cell depletion. Whereas in inflammation type 2 hypersensitivity reaction, what happens is, these outsiders are coming and creating a scene in front of home, recruiting more number of people to come and watch that. So what is that? Again here, antigen will be fixed over various of our tissues, but the antibodies will arrive there and they will not just take away the antigen, they will activate complement system. Then there will be chemoattractants, then there will be recruitment of neutrophils, macrophages. All these will lead to free radical release. That's what will end up in inflammation. So this is inflammatory type. Examples are Goodpasture syndrome and acute rheumatic fever. Whereas in type 3, that is receptor dysfunction, here what is happening? These outsiders will be appearing just like the one whom the kid is already knowing. So it is just like the molecular mimicry. So antigen, mainly the receptors like TSH receptor or acetylcholine receptors will be there and they will be waiting for TSH or acetylcholine. But similarly appearing antibodies will come and act there. So these are nothing but a kind of molecular mimicry leading to pathological manifestations like Graves' disease, myasthenia gravis and all. All these are receptor dysfunction. Receptor, that is the kid, is unable to recognize self and the similarly acting antibodies leading to pathological manifestations. So all these are some examples of type 2 hypersensitivity reaction. Just to revise, autoimmune hemolytic anemia, autoimmune thrombocytopenia, autoimmune neutropenia and glomerulonephritis, acute rheumatic fever and some receptor related manifestations like Graves' disease, myasthenia gravis, type 2 diabetes and pemphigus vulgaris. And just to mention about the pathway A, that is quiet depletion, where the abductors or the outsiders are just quietly taking away the antigen. That's what we have discussed. RBC will be there. Over that there is a fixed antigen. So the antibody will come and opsonize it, leading to the abduction of the entire molecule towards macrophages, mainly at the spleen, and leading to cell depletion. So this destruction is occurring without any inflammation, and these are the examples. Whereas in pathway B of type 2 hypersensitivity reaction, these antibodies are activating complement system, leading to recruitment of neutrophils, macrophages and release of free radicals causing inflammation. And the examples are like this. And receptor dysfunction we have already discussed. In type 3 hypersensitivity reaction, what happens here is, here both antigen as well as antibody, both are freely floating in the vasculature. So now we can imagine these are two entirely different individuals just meeting at a point on the road. And now they are going to fight, but they decide not to fight on the road. They will just agree that we will go to a particular place, there we can start fighting. This is what happens in type 3 hypersensitivity reaction. For example, free antigen and free antibody will be circulating and they will form immune complexes. So these immune complexes will activate complement system just to cause vasogenic reaction where there will be shrinkage of endothelial cells and there will be vasodilation, and these immune complexes will leak out of the vasculature in the interstitium, and the fight starts actually in the interstitium, not in the actual vasculature. But the problem is the blood vessels are there near almost every tissues. That's why these will lead to systemic manifestation in the body, leading to fever, polyarthralgia, malaise, pleuritis, pericarditis, and even vasculitic reactions. Now, though they have decided to leave that road, particular road, not to fight there and to go to some different place, but they will leave some of the clues on that particular road. That is, the endothelial cell activation to escape from the vasculature will lead to thrombus formation, creating microthrombi, which is one of the pathological hallmark of type 3 hypersensitivity reaction. And after escaping from the vasculature into the interstitium, when they start fighting, there will be localized necrosis, and which will be very severe, leading to fibrinoid necrosis in the interstitium, which is again a hallmark of this type 3 hypersensitivity reaction. So some of the examples are serum sickness. Previously, when for many diseases they used to give animal serum, we used to see such systemic manifestations, but nowadays with the usage of numerous drugs, we will see similar mechanism. Even farmer's lung and SLE, which you all know, is a systemic disorder, we can say, even rheumatoid arthritis and the arthritis reaction. So these are some examples where antigen and antibody are forming immune complexes and they are just escaping from the vasculature into the interstitium, and there they will ignite fibrinoid necrosis. Coming to type 4, which is called as delayed type of hypersensitivity reaction, and it is mainly cell mediated one. And remember, there are no antibody involvement in this type. Mainly it is T lymphocytes, cell mediated. So again, in T lymphocyte, we can divide it into two pathways, either CD4 T lymphocyte mediated or CD8 T lymphocyte mediated. So here, as we all know, in CD4 type, it is mainly driven by macrophages and helper T cells. What happens here is, when these macrophages are unable to clear the antigen completely by themselves, will present it to the helper T cells, and these helper T cells, with the further recruitment of numerous immunological chemicals, they will try to destruct the antigen completely. For example, in case of tuberculosis. And all these things will lead to granuloma formation, which is again a pathological hallmark of delayed type of hypersensitivity reaction, that is type 4 hypersensitivity reaction. Whereas in CD8 related type 4 hypersensitivity reaction, this is called as cytotoxic. Here what happens is, the intracellular microbes like some viral infections or even tumor cells, they will represent the small portion outside the cellular surface, and this will be recognized by T cell receptors of the CD8 T lymphocytes, and they will directly bind to the antigen and release numerous chemicals and enzymes, leading to the destruction of that particular antigen as well as the cell. So this is cytotoxic reaction. That is what is explained in this one. When it comes to CD4 related, for example, tuberculosis bacteria enters respiratory tract and it is taken up by macrophages in the lung tissues, but that cannot be completely killed. So what they will do is, these macrophages will present some part of antigen to the helper T cells and they will act as antigen presenting cells. So these helper T cells will start proliferating and they will release numerous chemicals leading to complete destruction of antigens. In this process, they will release TNF, tumor necrosis factor, and interferon gamma. So all these will attract numerous monocytes, endothelial cells, and they will produce chemicals such as prostaglandins. At the end, they will result in the destruction of antigen. But what happens is, there will be formation of granuloma. What is granuloma? There will be central caseous necrosis, which is again the hallmark granulomatous inflammation. There will be lots of destructive substances released due to the fight between the antigen and epithelioid cells. Those are nothing but modified macrophages, monocytes and all. And it is being surrounded by lymphocytes and epithelioid cells releasing growth factors, causing a restrictive wall of fibrosis in the surrounding. So if you see the structure, there will be caseous necrosis surrounded by a restrictive wall of fibrosis, and there will be surrounding lymphocytes and epithelioid cells. Sometimes they will appear too huge, which we call as giant cells. So these are all the pathological hallmark features of granulomatous reaction. This mechanism I have already explained. For example, some viral infections and all to a particular cell. The cell will keep the part of antigen outside the cell surface, and this will be recognized by T cell receptor. When they bind to this antigen, they will release lethal chemicals like perforins, granzymes and caspase activation, making multiple perforations into the cell. So along with the destruction of this particular cell, they will just make this particular antigen to come out so that it is being phagocytized and the antibodies will attack that particular antigen. This is the complete destruction of the cell, and it will be very much precise. So all these are the hallmark chemicals involved in this type of reaction: perforins, granzymes and caspase activations. What are the examples of type 4 hypersensitivity reaction? Tuberculin test and contact dermatitis. So just to summarize, in type 1, the antigen will be a free floating antigen or a foreign body like dust or pollen and all, and the antibody will be fixed one, that is IgE over the mast cells, and they will lead to release of histamine and leukotrienes, and we can see anaphylaxis, wheel and flare reaction. In type 2, there will be fixed antigen over the tissues. You can imagine about autoimmune hemolytic anemia, and the antibodies such as IgM and IgG will be freely floating and they will reach that antigen site, leading to 3 different types of clearance of that particular antigen, like phagocytosis, complement activation and inflammation, and receptor dysfunction mediated mechanisms. In type 3, both antigen and antibody will be freely floating and they will form immune complexes which will escape from the blood vessel into the interstitium, leading to microthrombi and fibrinoid necrosis, which are the hallmark features. Type 4, just now I have mentioned, it is cell mediated and usually the antigen will be intracellular, which is not being killed completely by the macrophages. Now in that case, CD4 and CD8 T lymphocytes will come into action and there will be granuloma formation or usage of perforins, and the hallmark feature will be caseous necrosis. I hope you have understood about all these hypersensitivity reaction, and the depiction of those local fight stories will help you in clear imagination and easy remembering of this particular important topic. Share it among all the undergraduate medical students. Also, I have mentioned that this was a 10-marker exam question in January 2025. Please make notes of all these things so that you can elaborate further in the exams. See you in another such informative video. If our videos are informative and helpful to you, do not forget to subscribe our channel